Let's take a closer look at the results just to make sure you all out there are looking at the right things. So once again, Samantha, her before picture and her after picture. What I want to highlight is what Dr. DiBernardo is doing in comparing his results. A couple key measurements. He measures from this point down to the nipple, and then the distance from the nipple down to the crease. That's how we plastic surgeons determine how much lift has taken place. Well, in the after picture, clearly you can see there's more fullness up in here, that this distance has been lifted and reduced at this point, and the distance from the notch here is less. The breasts have been lifted. In fact, it looks like the volume has shifted from down below to up top. So in a lot of ways, it looks like an augmentation result.
And we've talked about this type of technology before, but now is this something new for breasts?
Using heat to tighten skin, not just immediately, but down the line. As you heat the skin, in this case, we're using radio frequency energy that's going to do two things: tighten elastin and stimulate collagen production. We've done it in the face. We've talked about vaginal rejuvenation using this technique. Now we're using it in the breasts. So tell us more about it, Barry. Barry and I go way back. I've known this guy 25 years.
Exactly. Well, Drew, what's happening is there are vertical fibers under the skin. By heating those, it's shortening them. Then we're stimulating at a certain temperature the cells called fibroblasts, which make collagen elastin. It makes your skin more plump and more tight. And we're doing that 360 degrees around the breast. So it's not only lifting it, it's tightening and rounding the whole breast. So we're making it younger skin, whereas in surgery, even if we do a surgical procedure with scars, it's still old skin.
So Samantha came in thinking that she was a candidate for some type of surgical procedure. You looked at her and thought she was ideal for this technique.
Well, she's young, and she actually came in for a breast augmentation, but I said, your breasts are hanging more, and if we do that, it's not going to look like a nice young breast. So what we wanted to do is get that tight and get her skin back to her age, and then if she wants them bigger later, we can still do an augmentation, but without the scars.
When you do this, how long are you expecting the results to last?
We've done this procedure for the last several years in other parts of the body, and we're getting years out of that, so this should not be any different.
We evolve as women, right? And then we still love our bodies, but, you know, for example, your body does change, and you're like, oh my gosh, when did that happen? For women, it may be perky breasts, you have perky breasts, and then a couple of years later, you walk by the mirror and you're like, now they're kind of down by my belly button. Yes. And you're like, when did that happen? Yeah.